Right now, tens of millions of American women are in menopause or perimenopause. A major turnaround by the FDA could encourage more of them to seek treatment for their symptoms. The FDA says it will remove the black box warning labels on many hormone therapy drugs. The FDA commissioner says the change ends a decades-long fear machine, something he calls, quote, one of the biggest mistakes in modern medicine. Joining us live now is Dr. Tami Rowen, Associate Professor at the University of California, San Francisco. Dr. Rowen, thank you so much for being with us. The FDA chief also called the warning labels on HRT an American tragedy. What were your initial reactions when you heard the news that those black box labels on many of these drugs are going to be taken off?
I have to say I was very pleasantly surprised. I think we had understood that maybe they would be removing the black box warnings on vaginal estrogen, which I have to say has been advocated and lobbied for years and years by many medical societies. So I was actually surprised when they were taking off the black box warning on all estrogen products, because that was unexpected.
A lot of women are going to hear this news and want to seek treatment right away. Where should they go first? Because it's important to note that you should work with the doctor on the appropriate regimen. And frankly, there aren't a lot of doctors like yourself that specialize in menopause treatment and aren't lucky enough to live in a big city where they do have access to doctors like yourself. Where should they go?
Well, I have to say, we've been prescribing menopausal hormone therapy for many years. So not just me, but OBGYNs, physician's assistants, nurse practitioners. So there's medical doctors, there's family medicine doctors who've been doing this. So we've been prescribing it despite the black box warning. We've had to explain the black box warning in detail and what our understanding of the evidence is. So I think that you can look locally to see who is comfortable. There are national menopause certified practitioners through the Menopause Society. There are actually telehealth companies who can practice and prescribe under really good guidance. And so as long as you feel like you are looking up these people, that they are providing evidence-based medicine, you don't have to be in a big city. There's a lot of different ways to access this level of care. And one of the most exciting things is that so many providers are now interested in this. And so one of the ways I spend a lot of my time, as many of my colleagues do, is by trying to educate people on both the science and safety, but also how to prescribe, how to do this, because we did not learn this in our medical training.
Absolutely not. And what stands out to me is not only is this hormone therapy safe for women, but the additional benefits that come with going on hormone therapy. Can you talk a little bit more about that?
Yeah, so, one of the biggest concerns always was the safety around cardiovascular disease, breast cancer, and stroke. And I think we have really good data to show that the breast cancer concern, especially when it comes to estrogen specifically, and remember, there's different ways we give estrogen. You can take it orally. There's a bioidentical estradiol. There's conjugated equine estrogen. It's overall pretty safe, but it actually isn't just that it doesn't cause breast cancer. In the Women's Health Initiative study, they showed that it reduces the risk of breast cancer if you're taking this specific conjugated equine estrogen alone. The concern is that estrogen can lead to an increased risk of endometrial cancer. That's uterine cancer. So we give it with a progestin, and that's where the nuance comes in terms of risk. But the safety and the benefit is unequivocal in osteoporosis. So it's actually FDA approved to prevent osteoporosis, which is a very big deal for women who may have a hip fracture. That is a leading cause of mortality in older women. If they're taking estrogen, it prevents osteoporosis. So we see that benefit. And then there is some debate about other benefits. I think that many of them are questionable. Some people say, and it was said today, that it prevents Alzheimer's disease. The randomized control trial data does not seem to suggest that, but people do feel a benefit in terms of cognitive symptoms. So brain fog is one of them. And certainly vasomotor symptoms, the hot flashes, the night sweats, those things can be a marker of cardiovascular disease, and those do improve. And there is some data that suggests that there could be some benefit cardiovascularly from these medications.
Some really exciting news for so many women here in the U.S. Tami Rowen, thank you so much.